Hi there, have a nice day. Today we continue with part 3 of anti-emetic. We deal here with the prokinetic. These drugs act as adjuvant or as anti-emetic promoting the gastrointestinal transit and speed the gastric empty rate, so decrease the incidence of vomiting or nausea. And this is occurred by enhancing the coordinated propulsive motility, enhance the propulsive motility. This exclude transitional choline mimetics or anticholinesterase, which produce tonic and largely uncoordinated or uncontrolled contractions. As you know, anticholinesterase inhibitor act through what's called sludge, salivation, lacrimation, gastrointestinal, urination, gastrointestinal tract side effect, and emesis. The prokinetic drugs increase the movement of ingested material through the GIT tract. This is the action of the prokinetic, which promote the movement of ingested material through the gastrointestinal tract and thus decrease the incidence of vomiting. These drugs include metoclopramide, domperidone, cisapride, mosapride, and itopride. In details with each one of these drugs. Firstly, we talk about metoclopramide, which is commonly a used drug, classical name Placine. Its act on D2 receptor antagonist, closely related to phenazothiazine group, act on the chemoreceptor trigger zone. Also, it has a peripheral action on the gastrointestinal tract itself. It's act as central dopaminergic antagonist and peripheral cholinergic agonist. It's not only added to antiemetic effect, but it's explain its use in the treatment of gastrointestinal reflex, hepatic, and biliary disorder through its action on the stomach. Here we deal with the action of the drug. As you see, its act on the dopamine. Dopamine activates dopamine D2 receptor, causing the gastric dilation and lower esophageal relaxation, and the incidence of nausea and vomiting. Metoclopramide block D2 cause stopping of these mechanism. Also, metoclopramide act on 5-hydroxytryptamine agonist, which when activated promote acetylcholine release, cause contractile motility, and act as cholinergic agonist inside the stomach or the gastrointestinal tract. So, metoclopramide block dopamine receptor in the central nervous system, responsible for the chemoreceptor triggers are responsible for the nausea and vomiting, and its act elsewhere in the central nervous system, causing unwanted side effects such as disorder of the movement, fatigue, motor restlessness, and spasmodic torticollis, which is involuntary twisting of the neck. Also, is cause oculocardiac crisis and extrapyramidal side effect, which is associated with the dopamine receptor. It's also acted through stimulation of prolactin release, causing galactorrhea, the prolonged use, or gynecomastia in male, and disorder of the menstruation. Uh, 10 to the pituitary gland, anterior and posterior pituitary gland, and the innervation. Dopamine receptor play a role in the releasing hormone from the anterior pituitary gland, and so on. The action of the metoclopramide on the GIT, on the upper GIT, increase the gastric peristalsis and relaxing of the pylorus and the first part of the duodenum and speed the emptying rate. While in the CNS is effective as anti-emetic, acting on the chemoreceptor triggers on blockage of the dopamine D2, and the gastrokinetic contribute to the anti-emetic. So it's the gastrokinetic act as prokinetic and as anti-emetic, and both mechanisms there is a synergism between the two mechanisms. It's rapidly absorbed, can enter blood-brain barrier, closing the placenta secreted by the milk. This is positive and negative. Crossing the blood-brain barrier is a positive point, also responsible for the side effect. Crossing the placenta may cause extrapyramidal side effect in the fetus, and secreted in the milk may be used in caution during for the lactating woman. It's partly conjugated in liver and excreted in urine within 24 hours and can be given orally in IM or IV. Duration of action lasts 4 to 6 times, can be given 3 to 4 times daily. It hastens the absorption of many drugs such as aspirin, diazepam, and through facilitating gastric empty rate. So the drug absorbed by the duodenum, we facilitate the absorption of them through bulging them through uh, increase the gastric empty rate, facilitate the gastric empty rate, so reaching the drug to the site of absorption. Bioavailability of cimetidine reduced due to this drug is absorbed and act through the stomach, and by blocking dopamine receptor in the basal ganglia, abolish the therapeutic effect of levodopa, which act on the dopamine receptor. Side effect include sedation, loose stool due to increased gastric empty, can cause Parkinsonism, but should not be used to augment the lactation. Not harmful effects are known when used during pregnancy. There is small amounts secreted in the milk, but suckling infants may develop loose motion, dystonia, and myoclonus. Some condition we use metoclopramide to increase the milk production. For the lactating woman, it's used largely by the gynecologist, but at scientific point, sometimes it's not a scientific, there is no solid scientific evidence to be used, but it's used as practical or evident by some gynecologist. Use as anti-emetic or post-operative emetic, or with drug-induced uses, or with the migraine, with the radiation, but less effective in motion sickness. Gastrokinetic to accelerate the gastric empty rate, dyspepsia, and other function of the GIT, and can be used for with the GERD. Domperidone is similar to metoclopramide, but it is not crossed blood-brain barrier well as the metoclopramide. It's not readily penetrate the blood-brain barrier and less prone to the central side effect. Cisapride is benzamide derivative. It's prokinetic with little antiemetic property. Its lack of D2 receptor antagonist, while the itopride, other substituted benzamide, it has D2 antidopaminergic receptor and anticholinergic, anticholinesterase, acetylcholine is the acetylcholine potentiator, but low affinity for the 5-hydroxytryptamine 4 receptor and so no acetylcholine through this approach, but as anticholinesterase potentiate acetylcholine. The basis of the prokinetic may be different from that of cisapride and mosapride through action as anticholinesterase. Mosapride, it's a conjure of cisapride, similar prokinetic and lower esophageal tone action due to the action on the 5-hydroxytryptamine 4 agonist, which is the major effect, and 5-hydroxytryptamine 3 antagonist, which is the minor effect in the mesenteric plexus. شكرا لحسن الاستماع. Thank you for listening.